All right, buckle up, because today we're peeling back the layers on a condition that keeps countless horse owners scratching their heads, literally.
Oh.
We've got a fantastic stack of research on equine atopic dermatitis, and our mission is to distill it down to the absolute must-knows for you.
It's a topic that might seem, well, a bit niche perhaps, but for horse owners and enthusiasts, it's a significant, often really frustrating concern.
Absolutely.
We're going to really unpack what equine atopic dermatitis, or EAD as we'll call it, actually is, how veterinarians kind of navigate its tricky diagnosis.
Yeah, tricky seems like the right word.
Definitely. And most importantly, the multifaceted long-term approaches to managing it, all while considering, the outlook for affected horses. We want you to walk away not just informed, but genuinely understanding the complexities and the day-to-day realities of living with and treating EAD.
Okay, let's unpack this complex name then. Equine atopic dermatitis. What exactly is it? Our deep dive reveals it's a multifactorial disease, sort of complex origins, where a genetic predisposition makes a horse's body overreact to otherwise harmless things in its environment. It's like their immune system has an overactive alarm bell.
That's a great way to put it. Essentially, a horse's immune system, specifically certain cells and antibodies called IgE, they overreact dramatically to normally benign environmental allergens like pollen or dust.
Wow.
Imagine their body's alarm system screaming threat when it's just, a friendly breeze. And while we're still mapping out every single detail of how this happens biochemically in horses, that's the pathomechanism, we see striking similarities to human and canine allergies.
Oh, interesting.
Yeah, and that helps us understand the underlying immune confusion, sort of.
So that's the science bit. But for an owner out there, what does this actually look like on their horse? What are the key red flags they should be watching for?
The primary clinical sign, the one that really jumps out, is pruritic, that relentless, maddening itch. It often starts on the head and legs.
Okay, head and legs first.
Yeah. Initially, it might be seasonal, maybe just spring or summer. But what's kind of fascinating, or frustrating, depending on your perspective, is how over time, it tends to become more severe, more generalized.
It spreads out more.
Exactly. And eventually, year-round, this constant itching can lead to secondary lesions like hair loss, which we call alopecia,
Right.
skin abrasions from scratching, known as excoriations, and crusting. It can also present as hives, or urticaria, think of them as whelks or raised bumps, similar to what you might see with a severe nettle rash on human skin.
Right. Okay. So the skin is clearly a primary battleground for EAD, but does this hypersensitivity spill over into other parts of the horse's system? Our deep dive touched on some interesting connections there.
It absolutely does. While primarily a skin condition, there's evidence that equine asthma, you might know it as heaves or recurrent airway obstruction.
Yeah, I've heard of heaves.
Right. That may also be due to a hypersensitivity to airborne allergens in some horses. This really highlights the systemic nature of allergies in equines. It's not always just skin deep.
That's fascinating. And what's striking in the research is that EAD ranks as the second most common hypersensitivity in horses, right after insect hypersensitivity.
That's right.
So what are these environmental allergens causing such a stir then?
Well, the most common culprits are things like storage mites, in hay or feed,
Yeah.
mold spores and pollens.
The usual suspects for allergies almost.
Pretty much. Their occurrence can be strictly seasonal or perennial, depending on where you live, the climate. And here's a crucial, often overlooked insight. Many horses also battle concurrent insect hypersensitivity.
So it's not always one or the other.
No, exactly. It's like having two small fires that, when combined, create a raging blaze. We call it the summation effect.
Summation effect, okay.
Yeah, so this means a mild reaction to pollen combined with a mild reaction to insect bites can push a horse into severe debilitating symptoms, requiring a very different, more intense management approach.
That makes sense.
It's also important to note that while you sometimes hear Arabians are more predisposed.
Oh, yeah. Anecdotally.
Yeah, exactly, anecdotally. But the solid genetic basis of EAD is still largely unknown. What's interesting is that it affects horses worldwide, with no identified age or gender predisposition, really.
Okay. This next part is where the rubber truly meets the road for both vets and owners getting a definitive diagnosis. It sounds simple, maybe, but our deep dive reveals it's a real puzzle. What's the fundamental principle vets rely on when a horse comes in scratching?
Well, here's the first big insight. Diagnosing EAD is less about finding a smoking gun and more about a meticulous process of elimination.
Oh, okay. Exclusion.
Exactly. It's truly detective work. Veterinarians have to rule out every other possible cause of itching before they can confidently say, okay, this looks like EAD. We call this diagnosis by exclusion.
So you're looking for parasites, fungal things, other allergies first.
Precisely. Other hypersensitivities, ectoparasitic diseases, you name it. And this isn't just a clinical step, it's a significant time and, frankly, financial commitment for owners, too.
That sounds incredibly thorough, but also, yeah, potentially incredibly time-consuming and maybe expensive for an owner. Are there ever shortcuts, or is this meticulous ruling out absolutely non-negotiable for an accurate diagnosis?
Shortcuts aren't really an option if you want an accurate diagnosis, honestly, because so many conditions look similar on the surface.
Right.
But while there isn't a single diagnostic test for EAD itself, several tests can help identify the offending allergens. That's the key distinction.
Okay, so tests for the triggers, not the disease itself.
Exactly. For example, blood tests like an ELISA can identify specific IgE antibodies in the blood. They're like the immune system's little allergic flags that signal a hypersensitivity to certain environmental triggers.
Okay.
Then there are intradermal skin tests, or IDT. That involves introducing a panel of region-specific allergens directly into the skin to detect these allergen-specific IgE flags right there in the skin tissue.
Wow, so the tests aren't a definitive, yes, your horse has EAD, but rather tools to help maybe tailor treatment if it is EAD. Does that mean a horse could test positive for an allergen and not even show symptoms?
Precisely. That's a really important point. Both false positive reactions and results indicating what we call subclinical sensitization can occur.
Subclinical meaning, no obvious signs.
Yeah, the sensitivity is there, but it's not causing problems yet. Even perfectly healthy horses can show positive reactions to allergens on these tests.
Really?
Oh, yeah. Although horses that do have EAD or urticaria or severe asthma tend to show more pronounced reactions, more positive results usually.
Okay.
So these tests, combined with the patient's history, like is it seasonal, where does it itch most, they serve as a crucial guide for selecting which allergens to potentially use in a specific treatment called allergen-specific immunotherapy, or ASITE. We'll talk more about that.
All right, A-side. Got it.
And, of course, we still need those other diagnostic procedures like skin scrapings and dermatophyte cultures. They're crucial for meticulously ruling out other causes like mites or ringworm. And skin biopsies, while not diagnostic for environmental allergies specifically, can help rule out other weird things.
It really sounds like a process.
It is definitely a process.
Okay, so this brings us to management. Given this is a chronic, lifelong condition, it sounds like effective management is multifaceted and requires a really long-term, individualized approach. So where do you even begin? What's the gold standard strategy our sources point to?
Well, the gold standard, the sort of ideal scenario, is identification and avoidance of the offending allergen.
Makes sense. Avoid the trigger.
Exactly. While this sounds straightforward and logical, in reality, many of these triggers, these etiologic allergens, are ubiquitous. They're everywhere. Or sometimes you just simply cannot identify them. So complete avoidance becomes impossible in most cases.
Yeah, I was going to say, how do you avoid pollen?
Right. It raises an important question for owners. How realistic is avoidance truly in their day-to-day life with their horse?
That's a powerful distinction. So if complete avoidance isn't always possible, which it sounds like it rarely is, what are the other pillars of management that owners and vets rely on?
Management focuses on several key areas. First, reducing allergen exposure as much as you possibly can. Second, controlling that intense itching to improve the horse's comfort. That's huge.
Quality of life, basically.
Absolutely. Third, treating any secondary infections that pop up because the horse is scratching itself raw. And fourth, trying to modulate the immune response itself.
Okay, can you give some examples? Like for reducing exposure?
Sure. So if dust mites are a known trigger, strategies might include housing horses outside more often, maybe using low-dust bedding like shredded paper instead of straw, and soaking hay to reduce the dust particles.
Right, soaking hay is common.
Very. For pollen, maybe keeping horses stable during peak pollen times, early morning, late afternoon sometimes, or even using air filters in barns, although that can be costly and challenging.
And what about sweet itch or summer eczema, which seems to be linked to insect bites? That sounds particularly frustrating as insects are, well, everywhere.
Oh, insect bite hypersensitivity, yes. Often from culicoides, midges, those tiny little biting gnats or black flies or stable flies. It's a very common trigger and incredibly frustrating to manage.
I bet.
Physical barriers like full-body fly sheets are absolutely crucial, like head-to-tail coverage.
Those mesh suits?
Exactly. Stabling horses during dawn and dusk, when culicoides are most active, and even using strong fans in stalls can help deter flying insects. They don't like moving air. And, of course, topical insecticides and repellents are also key components, though you have to apply them consistently.
Beyond environmental controls then, what about medications for managing these persistent symptoms?
Okay, so corticosteroids like prednisolone or dexamethasone are highly effective for rapidly controlling severe pruritus and inflammation. They work fast.
The big N, sort of?
Kind of, yeah. They can be given systemically, like orally or by injection, or sometimes topically for just localized lesions. However, long-term systemic use carries significant risks, like laminitis, which is a huge concern.
Oh, definitely.
So they are typically tapered down after the acute flare-ups are under control. Then you have antihistamines. They're less potent, and honestly, the results are variable from horse to horse.
Hit or
A
miss.
bit hit or miss, yeah. But they can be helpful for mild to moderate itching in some cases. And then there's supplementation with omega-3 fatty acids, like from flaxseed oil.
Oh, yeah, I've heard of that for skin health.
Exactly. They can have anti-inflammatory effects and might improve the skin barrier function over time. But it's not a quick fix. Effects might take weeks, even months to become apparent.
So patience is needed there, too.
Definitely.
Okay, so we've talked about managing symptoms, environmental stuff, meds. But what's the only specific treatment mentioned in our sources? Yeah. The one that actually offers a chance to get at the root cause and potentially offer a form of cure or at least significant long-term relief.
Ah, yes. That would be allergen-specific immunotherapy, or ASITE. Allergy shots, essentially.
What people get.
Very similar principle. It's truly unique because it's the only treatment that targets the underlying allergic mechanism itself. It involves injecting small, gradually increasing doses of the identified allergens over time.
The ones found in those tests earlier.
Precisely. The goal is to gradually desensitize the horse's immune system, essentially teaching it not to overreact so violently.
Does it work well?
It has a pretty good effectiveness rate, actually. Approximately 60–80% for reducing the itching and, importantly, reducing the need for other symptomatic medications like steroids.
That sounds promising.
It is. However, and it's a big however, it requires a significant long-term commitment from the owner, often lifelong.
Lifelong shots.
Often, yes. With injections maybe every 1 to 4 weeks. And it takes time to work. You might not see the full benefits for 6 to 12 months.
Wow, okay. So it's a major investment in time and effort. 60 to 80% effectiveness sounds promising, but it's not 100%. What happens for that 20–40% where AST doesn't work? Does it mean going back to square one with symptomatic relief, or are there other options for those really tough cases?
That's an excellent question. And yeah, it's a real challenge for owners and vets when AST isn't enough. For those severe refractory cases, the really stubborn ones, an immunosuppressive drug like cyclosporine can be considered.
Cyclosporine. I've heard of that in human medicine.
Yes, same drug family. It can be highly effective in some horses, really turning things around. But it is expensive, quite expensive, and it has potential side effects, so it requires careful monitoring by the vet. Blood work, things like that.
Right, so other layer of complexity.
Definitely. And beyond these systemic medications, we shouldn't forget topical treatments, medicated shampoos, soothing rinses. They're really important for temporary relief and for managing those secondary bacterial or fungal infections that often happen because the horse is constantly damaging its skin barrier by scratching.
Makes sense. Keeps things clean, helps healing.
Exactly. And, if we connect this to the bigger picture, successful management truly hinges on the owner's unwavering commitment. It sounds like a broken record, but it's true.
You really have to be all in.
You do. They need to understand this is a chronic disease requiring ongoing long-term management. They're active participants, needing to constantly assess the horse's response to therapy, tweaking things, and knowing when to call the veterinarian back in.
So after all this effort and dedication, what does this all mean for the horse and its owner in the long run? What's the prognosis? What can they realistically expect for a horse diagnosed with EAD?
Well, the first thing to grasp is that EAD is a chronic, lifelong condition. Spontaneous remission where it just goes away on its own is rare, very rare.
So it's about control, not cure.
Exactly. The goal of management is to control clinical signs, keep the horse comfortable, not necessarily to cure the disease entirely. With that said, the prognosis is generally fair to good for achieving a manageable quality of life if appropriate and consistent management is in place.
But it sounds like a significant commitment, not just in time and effort, but financially too. Is it truly a marathon, not a sprint?
It absolutely is. A marathon is a perfect analogy. Management requires consistent effort, a significant time investment, daily or weekly, and often substantial financial investment for vet visits, tests, medications, special bedding, fly gear. It adds up.
Yeah, I can imagine.
And relapses are common, especially with changes in season, moving to a new environment, changes in feed. Finding the optimal plan often involves trial and error. What worked last year might need adjusting this year.
So constant vigilance.
Pretty much. And while ASIT does offer the best long-term success rate, as we mentioned, it's not 100% effective for every single horse.
Right. What are some of the potential complications if that relentless pruritus isn't well controlled? What happens to the horse then, physically and maybe even mentally?
Good question. Chronic pruritus and that relentless self-trauma, well, it can lead to nasty secondary bacterial infections, sometimes deep ones. You can see thickening and darkening of the skin, what veterinarians call like enification and hyperpigmentation.
Like leathery skin.
Yeah, almost like elephant skin sometimes. And significant hair loss and raw skin abrasions are common. If it's not well controlled, it can severely impact the horse's comfort, its trainability. Imagine trying to focus when you're intensely itchy.
Impossible.
Right, and just its overall well-being. Severe itching can even interfere with tack fit and riding, potentially affecting a horse's athletic career or just its usability as a pleasure horse.
That's a huge impact.
It is. And this also raises an important, sometimes difficult question for owners considering breeding. Affected horses, especially those with severe clinical signs, are generally not recommended for breeding due to that likely genetic predisposition we talked about earlier.
Right, don't pass it on.
That's the thinking, yeah.
So, a good to fair prognosis, but with significant nuances depending on the severity of the EAD. It sounds like it can be a really difficult journey for some owners and horses.
Exactly. Horses with mild, perhaps seasonal EAD, particularly if it's mainly insect-related and manageable, with good avoidance strategies and maybe some topical treatments, they generally have a very good prognosis for a comfortable life.
That's good news for some.
Yes. However, for those horses with moderate to severe perennial EAD, the ones itchy year-round, much more intensive management, likely involving systemic medications, maybe ACID, will be required. The prognosis for these horses is still good to fair for achieving a manageable state, but it will truly be a continuous, evolving effort.
And in the worst cases?
Well, in extreme cases of intractable pruritus, where the itching just cannot be controlled adequately and the horse's quality of life is severely compromised, euthanasia might unfortunately need to be considered as a last resort. It's a heartbreaking decision, but sometimes it's the kindest one.
Wow. That really underscores the seriousness for some.
It does. Successful management ultimately hinges on owner compliance, a strong veterinarian-client-patient relationship, real teamwork, and a willingness to adapt the treatment plan as the horse's needs evolve over time.
Well, that was truly a deep dive into equine atopic dermatitis. From understanding its elusive pathophysiology and that tricky diagnosis to navigating the really long-term commitment of management, it's crystal clear this is a condition that demands dedication and patience from everyone involved.
It really is. And it's a testament, I think, to the fact that for many chronic conditions, not just in horses, the true cure lies not in a single magic bullet, but in consistent, informed, and adaptable management over the long haul.
Yeah, that's a great point. And perhaps that's our provocative thought for you today.
Right.
How many aspects of life, maybe beyond animal health, require this kind of long-term adaptive partnership to achieve those good to fair outcomes, rather than us just seeking a simple one-time fix?
Interesting question.
Maybe consider how you approach your own persistent challenges, big or small, with a similar mindset of ongoing flexible management rather than just hoping for that quick fix. Something to chew on.